before I do, I will just say that I'm professor of social medicine at Uppsala University, but originally I come from Hungary, which some people might see on my name. And no one who knows me is surprised that I ended up doing this study with children with complex communication needs, because I kind of grew up with these symbols around me, because my mother, Sofia Kalman, was the one introducing these symbols into Hungary. So I have been there from the very early days, from the 80s. So like I said, no one is especially surprised, but this is not my usual area of expertise, and I don't know anything about alternative and augmentative communication, but I do know about kids and families. And we do a lot of research looking into, this is my research group, child health and parenting, and we're always very interested to hear what children and families have to say to us. And of course, because there was a pandemic, we needed to find out what they think about this. So on the spring of 2020, we conducted a web survey, and this was directed to typically developing children, 4 to 18 years old, to ask what they thought about the pandemic, if they felt any worry, what was good, what was bad. Now, over 1,000 children and youth answered. 8 of 10, so 80% expressed worry. And of course, they missed older relatives and friends because you couldn't meet. And some thought Corona was not too bad, or at least it was good for the climate and nature, because there was less flying and transport and more time for family. And Sweden kept schools and preschools open, which children thought were really positive. And then the youth thought that distance education was kind of both good and bad. But the interesting thing here was that we really did want, we had a pictorial support part of the questionnaire, because we were very keen to get all kinds of answers with all kinds of children, but we only got 2. So we thought, well, that's not good enough. So we made another study, an interview study, where we really wanted to find out how children with complex communication needs and different disabilities were feeling during the pandemic. So we got, this was an initiative of the Public Health Agency in Sweden, who were keen to find out. And we did qualitative interviews, and these are the children that we talked to. These are, of course, made up names, they're pseudonyms. And the children were between 5 and 12 years of age, and they had different types of underlying medical conditions, but most of all, they all had complex communication needs. Many of them were not non-verbal or minimally verbal. And I promise I didn't make the interviews, because you have to be a specialist to do this. It was a speech and language therapist who is a really terrific person, and she is communication. The whole person is communication. She's fantastic. So these were done on Zoom, actually. And we used anything that the children use themselves in terms of AAC. So obviously bliss symbols, pictorial support, any kind of support. And we developed specific visual analog scales for this project. So this is an example of how worried you feel with the 1 and the 10, and then depending on the ability of the individual child, the speech and language pathologist would adapt, and you will see this in the transcripts. So this is about if you're worried about older people. So what did they tell us? Well, it was, what do you think was bad with the pandemic? And it was lonely. A lot of these children lost a lot of their social networks because of the pandemic. So this is Robin pointing to the pictorial support and saying, look, me alone. And then the interviewer signs, so you feel alone. And yes, so it was lonely during the pandemic. And it was boring. So this is Alexis pointing to the screen. He's trying to point to this, the visual analog scale. So which one did you point to? And it says boring. Okay, boring. So boring, yes. Well, you know, I also think it was really boring with Corona, super boring. But how boring? So this is an invitation to use the visual analog scale. Not boring, in the middle, whichever number you want, or super duper yuck boring at 10. And so Alexis says just 7. And what about worry? Were these children worried? And yes, they were. So this is Ellie using bliss symbols. So showing a sign for great or very on the board. And so the assistant who is assisting here in the interview says, okay, so that's a 10. When Ellie does that, that's a 10. Oh, is that a 10? We're up on a 10. Is 10 okay then, says the interviewer. And then Ellie nods. A 10, a very super duper worried. And Ellie gives this huge nod and then starts eye pointing to the communication board and says, and the assistant helps and says, thinking about grandma will die and grandpa especially. So no one had any idea that Ellie had these thoughts because the family was very worried about Ellie getting sick of the coronavirus. And in fact, and I'm sure that this is by no means any news to those of you working with AAC, that many times parents don't appreciate the level of knowledge and awareness that the children have in many different issues, existential and whatnot. So this is a young child, this is our youngest, and the parent says, who are you afraid of ending up in the hospital? Because this has been discussed. So Bobby makes a hand sign, which is not known to the interview, but it turns out that's grandpa. Grandpa, says the father, but you said you were afraid that someone would end up in a hospital there. Is there anyone in particular you're worried about? So the child has to explain again that grandpa. So the parent, well, oh, says the parent, kind of for the first time understanding that this child, 5 years of age, is actually worried about grandpa. So what about school then? And remember, schools were open in Sweden, and this is Michelle. Well, I think a lot of people are really close together. So this is clearly a child who is verbally able, most often in the restaurant. So when you stand in line, everyone pushes around and their arms touch, and there are many people in the corridors as well. So he was concerned about this child with autism. He could read all the guidelines of the WHO and he could see that these were not followed in his school. So he was not pleased at all with this. So if we summarize what the children told us, what was bad about the pandemic, well, it was lonely and it was boring. And they were worried. They were worried about their grandparents and older relatives. And this is exactly like the typically developing children who also were worried about their grandparents. Now, interestingly, we also asked these children what was good about the pandemic. And remember that the typically developing children said things like, I get to spend more time with my family. It's nice for nature. It's nice for the climate. I don't need to stress so much about school. But in fact, there was very little, if anything, that was good that these children told us. And I found that interesting. I mean, it's possibly that the pandemic effects were more severe on the social networks and on the participation of these children who we interviewed. So then, just as Annie made it very crystal clear to everyone, given the right support, and in our case, interviewing expertise, children with complex communication needs can really express their thoughts and worries about Corona. And in fact, the children had knowledge about the pandemic, missed their grandparents, and in fact could even express existential concern. And the parents were very surprised, and several parents lack tools to communicate about the pandemic with their children. So they asked us for our interview guide with the pictorial support so that they could use it later on. And what we said to the National Public Health Agency is that it's really important to remember the needs of children and families with the complex communication needs, also in crisis, because a societal crisis is a crisis for them as well, of course, and the children will not be untouched by it, and we know about it. And yes, we also saw that the interviewed children did miss quite a lot of school and preschool, not because these were closed, but for insufficient adjustment. And we also saw an indiscriminate exclusion of support persons, among other people, those who could assist with their communication. So of course, then they weren't as keen to attend. So now we know the answer, at least in Sweden, how well, not all, but at least a pattern of how the pandemic was perceived. And I guess the message is to never forget about all children when we talk about these things that are relevant to all of us. Sorry. So thank you very much.